CA is a 67-year-old female Asian with birth date of 12/5/1952. She is here today because of worsening cough. She started to have coughing and nasal congestion 2 weeks ago, and this coughing did not go away but worsened. She started to have a productive cough with the yellowish thick phlegm 5 days ago. This is accompanied by or associated with left rib cage pain, and she's been having low-grade fever between 99 to 99.6 since then. She has mild headaches. She has also occasional chills. She has decreased appetite and feels weak. She doesn't have any sinus pain, no earache, no sore throat, no chest pain. But last night, what alarmed her, she started to have shortness of breathing and wheezing, and her cough is worse at night. This morning, she had emesis. She stated that her rib cage pain rates 5 to 6 using scale of 0 to 10, and she tried home remedy of ginger tea that is warm mixed with lemon and honey with mild relief. She did not take any over-the-counter medication to help with her coughing and nasal congestion because she had a previous experience that her blood pressure went very, very high. She lives with her husband. She did not remember having any contact with someone that is sick. She has an updated pneumonia and influenza vaccine. Pertinent medical history: she has hypertension. She's on valsartan, atenolol, and clonidine. Takes atorvastatin for hyperlipidemia, and takes Actos and glyburide for her diabetes. What is pertinent with this case is she is on immunosuppressant. She takes prednisone, Celsip, and Prograf. She was a status post kidney transplant in 2001. She was a recipient of a kidney due to IgA nephropathy. Vital signs is unremarkable. Febrile 97.6, pulse rate is 90, respiration is 22, blood pressure is 136/76, O2 is 91% while at rest. She appears mildly ill, but not in distress. Alert and oriented ×4. No inflammation and erythema in her ears. Left turbinates with mild swelling and erythema. Tonsils are not enlarged. No erythema and exudate noted. Frontal and maxillary tenderness not noted on palpation. Check for any lymphadenopathy. There's none noted. Heart rate regular, S1 and S2 normal, no heart murmur. Lung sounds with expiratory wheezing, noted with mild shortness of breathing while sitting at the examining table. E did not change to A to check for egophony while auscultating lung sounds. Abdomen is soft, non-tender. No CVA tenderness, no swelling on both lower extremities. Capillary refill is less than 3 seconds. Differential diagnosis: acute bronchitis unspecified. This is related to the 2 weeks coughing and nasal congestion with body malaise, mild headache, decrease in appetite, and low-grade fever. Another one is upper respiratory infection. It could be viral in in nature, and also just chronic coughing. Final diagnosis is acute bronchitis unspecified. Plan of care, while in the office, I'm gonna give her albuterol neb treatment to check if the wheezing and the shortness of breathing will improve. What I'm trying to do here is trying to avoid her from going to the hospital and be admitted there because of her immunosuppression, and to think of the current situation. We have incidences of flu and also coronavirus, so I don't want her to be exposed more to bacteria. I would give her albuterol every 4 hours times 5 days while at home. Tylenol 650 milligrams or acetaminophen for her headache, and Body-Malay, and also fevers, but not to exceed 4 grams. I will advise her if she can use humidified air, because that could help with coughing and nasal congestion. I will start her on doxycycline 100 milligrams twice a day times 10 days. Have enough rest, good nutrition, and fluid intake. CBC and chest x-ray. Advise her to call the office in 48 hours if condition did not improve. Seek medical emergency services for chest pain, increase in shortness of breathing, increase in temperature, and to come back in the office in 7 days for a follow-up.